The opinions in this podcast are all our own.
But the businesses are real chamber members.
It's a chamber chat.
Coming to you from Wahoo, Nebraska. Chamber Chat with Kate
And Kat.
Welcome to Chamber Chat with Kate.
And Kat. I'm Catherine Nygren, owner of Found and Flora Flower Shop.
And I'm Kate DeCoste, owner of Kate DeCoste Photography. This podcast is everything Wahoo Chamber of Commerce.
Well, Kate, we have another guest in the studio.
We sure do.
Yeah, we have Dr. Foland from Wahoo Creek Dental.
Hello, thanks for having me. It's always a pleasure to be here.
Thanks for coming.
Yes, and we didn't even say this before. You know, you were our top 10 of last year of 2025.
Yeah.
And I know we talked about it. The two of us both at separate times talked to you about it while we were in the dentist chair. Yeah, so it's kind of fun to have a
top 10
back
for 2026.
Yeah.
Exactly. We won't talk about how many total podcasts there were, but there was more than 10. So
You're right.
Yes. Definitely more than 10. Yes.
Yeah, I remember that was a question you had. You were like, so how many podcasts
How many were there?
No, take it as a compliment.
Yeah.
No, that's exciting. That's an honor. I mean, it means a lot of people were just kind of, curious and interested. And like, oh, this is that dentist in town. Let's hear what he had to say.
Right. Yeah.
Well, I feel like dentists and doctors, like you really don't like converse with them. Like you have like that couple minutes where like, okay, do I have cavities? Yes, no. And like, that's really all you know about them.
Yeah.
Right.
You know?
Yeah. So it is kind of nice just to like hear a little more about it.
There's a real person behind the scenes and not just like a robot that comes and looks at your teeth. And
Right.
Yeah.
So tell us what's going on in the practice. You've been here in town for 4.5 years.
Yeah. 4.5 years. Things have been going really good. We've been growing team, like a front desk and an assistant. And now we have 2 hygienists and 2 assistants and our front desk. And looking for another hygienist actually too to help take care of all the patients that are wanting to come see us. And so it's been really good. And so we're really looking forward to the future. Lots of changes, I think, to come. We're kind of on the beginning stages of trying to figure out what that looks like. But we're always have our goal in the forefront of our mind of just being able to provide top-notch treatment to top-notch patients.
Kind of going with that, I love that. I feel like there's a lot that you do more than just looking at our teeth and making sure that we don't have any cavities. I want to know, like, what's your like favorite thing that you do in your practice?
I think one of the most, say the 2 things that can just bring patients kind of a immediate satisfaction would be when we're doing kind of a smile makeover where, there's some of their front teeth that they've just not been happy with their whole life. Things are crowded or discolored, or they've had some fillings, and like, man, I just want to smile again. And those are satisfying to just be able to, do some proper restorations on those teeth to be able to give them that white smile, give them the correct shaped teeth, and really makes a difference in their life. And able to do it, in one day a lot of times, so they get to walk out a completely different person.
Wow.
And then the second thing would be, people that have had missing teeth for a while, have had, tried different things that haven't worked out, or they don't feel like a piece of plastic in your mouth to try to replace missing teeth isn't always the most fun. And so we do implants, and so it's the most natural feeling thing to a natural tooth that you're able to do. And so that gives patients their chewing ability back.
Yeah, like it's not even the just having like this, like the smile, but being able to chew, like just your like things that I don't even think you think that you just do that you don't wouldn't even think of, like, oh yeah,
you don't really realize how important they are until they're gone, and then
right.
So those are 2 of the things that I think I appreciate or I enjoy doing as far as dental goes. But then I also just love getting to meet everybody and get to know them. After being 4 years, I feel like I'm really starting to get a hang of knowing everybody that comes in and their family and their relation a little bit. And it makes just being able to step in and kind of start in where you left off 6 months ago. Before he was here. So it's been fun.
That's going to be hard trying to remember like everybody's like, you know, like little conversation bits with everybody, you know, when you walk in to do that little final checkup on your teeth. And you've always got something to talk about. And that's going to be hard.
Well, I was going to say like the 6 months and then being like, oh, hey, did you whatever, like finish that car project or whatever? Like,
there's always something somebody's got going on. There's, you know, good things and bad things. There's marriages and deaths and moves all the time. So keeping up with everybody's life is kind of fun, and I think they appreciate it when they know that you care more about just stepping in, taking a look at teeth, and being done.
Right. That you're caring about the person in the chair and having a little conversation. I'm sure you hear a lot of different subjects.
Yeah.
You know, like of what people are going to share, and I'm sure you have some people that are maybe just like, yep, I'm good. And then there's going to be those people that are going to be like sharing, maybe oversharing, or
that's we do a fair amount in our office, like in our meetings, just getting to know like our kind of personality styles, so we know how we behave and how to identify that in other people and the patients, so that we can kind of mirror and model the way the patient is and how they want to be talked to and how they want to be treated, so that we can treat them that way.
That's really interesting.
Yeah. So we call it the platinum rule. So instead of treating people the way you want to be treated, you treat the people the way they want to be treated. And so you kind of talk, if they're a big sharer and they love to share and they love to talk, then we're going to be the ones that ask questions and love to talk with them. If they're like, you know, I just want to get in here and you tell me if I need to do anything and then I'm going to go back to work, then we don't need to, they don't want to hear us talk a lot.
Right.
They don't want us to ask a lot of questions.
Right.
Like my daughter.
Yeah.
My daughter's like pulling teeth to talk to, but you know.
Yeah. So.
And then do you just kind of just gauge it and just kind of are like, okay, we can just tell that person is not going to be talkative.
Yeah. And everybody's new patient visit, we ask them what's most important to them, what their values are, and just so then we can have a good barometer to kind of know, okay, this is what's important to that patient regarding teeth and life, and so we know how we want to approach things when they come up. So
yeah, that's really interesting. Not just getting to know like their teeth and like the X-rays, but a little bit more about like what their goals are with their teeth, or I think that's really interesting.
So before we were hit record, you were kind of talking about maybe doing like a little expansion. You want to let us know about that?
Yeah, we're kind of in the beginning stages of trying to decide what physical space wise we're going to be looking at here down the road, but we do know we're ready for another hygienist just to help get some patients, get everybody in on time, get all the new patients in that are calling in a reasonable manner. And so part of that is going to look like at least one small little expansion, adding some rooms for patients for us to be able to see all of our patients. And then we're kind of comparing that, with maybe a bigger remodel, where we're really updating the entire space and planning for, 5, 10, 15 years down the road.
Wow.
So,
and then in your same location, you're talking about all of that.
Right now, that's the plan. Yeah.
Okay.
Yeah.
Okay.
So
that's great.
Yeah. So you're in Wahoo for the long haul.
Yeah. Well, yeah. And you are with the, we were saying too, that you moved to Saunders County. So you are in the long haul, at least in.
So we are here now, and the commute has been way nicer.
Oh, I'm sure.
It's fun having the wife and kids closer now, so we just get to see them a little bit more often, hanging around town, and we get to be a part of the community more and attend. Before it's kind of being in Lincoln, hard to attend all the community events here,
Sure,
commuting back and forth. But now that we're close, it's easy to run home, change after work, and then come back downtown and do whatever events we have going on. So it's fun.
Good. Hey there, listeners. Quick question. When was the last time you actually looked forward to going to the dentist? Yeah, we didn't think so.
But that might change after you meet Wahoo Creek Dental right here in Wahoo, Nebraska. Whether you're ready to straighten things out with orthodontics, restore your smile with some dental implants, or you're in a hurry and need a same-day crown, they've got you covered with the latest technology and a hometown touch. And here with us is Dr. Foland himself.
Glad to be here. Same-day crowns means no more wearing those awkward temporaries for weeks. You walk in, we scan, design, and place it the same day. We aim to provide a full suite of treatments with a personalized touch just for you.
So, if your teeth could use a little love, or you just want a dentist who treats you just like he would treat his mom, check out Wahoo Creek Dental.
Your smile will thank you. And hey, tell them your favorite podcast sent you. So what are some of the services that you offer that people might not know about?
Yeah. So I think most people kind of know, okay, general dentists are going to be able to do my fillings, they're going to be able to do my crowns, do my cleanings, make sure I don't have any cavities.
Mm-hmm.
But we try to keep as much of kind of the specialty dental work in our office as we can. So we do implants. We've been doing those for a few years now, so we've really got our workflow down pretty smooth on that.
Mm-hmm.
So any missing teeth, we can fix those up with dental implants to give you a natural tooth back.
Mm-hmm.
And then orthodontics. So we don't do our traditional, your metal band and bracket type orthodontics.
Mm-hmm.
At this time, we do clear aligners. So they're like Invisalign, so clear trays. So invisible, there's little attachments on your teeth that you can't see either. Treatment's generally pretty quick too. So 6 to 12 months is a lot of times how long treatment would take to really kind of change the shape of your teeth, or the crowding, fix crowding and spacing. So we do that for all ages. And the way it works for us is there's no cost at the start. So you come in, you get an initial consult. We kind of take a scan of your entire mouth. We take some photos, and we kind of plan, okay, what's possible here with our trays, and where's our end product? And we have you back. We look at how the teeth on like this 3D software, we look at how all the teeth are moving and what our final product's going to be. Talk about expectations of how often to wear trays, and as long as you can agree to what it's going to take to get there, and I think we're going to end up with the right end product, then you give us a thumbs up or thumbs down, and then we start plugging away at it.
Nice.
Yeah.
And when you get those trays, how often do you have to have an appointment? Is that just kind of on your own then to switch out trays, or are you seeing those patients a little bit more?
Slightly based, case by case of how often I'll see them, but you will get a set of trays, generally about 8, and you change them about once a week. And so every couple months you'll come in, I check, just make sure the teeth are tracking appropriately, they're moving the right way and doing what we need them to do. And you get another set of trays, and we see in a couple months again.
Okay.
Yeah. Ortho has always been, from even before I started here, something I thought Wahoo could really benefit from in town, because otherwise you have to drive 30 minutes to an hour for a 3-minute appointment at your orthodontist, and then you have to come back. And for moms and dads taking their kids out of school and taking time off of work, that can be a lot.
Yeah. Well, and Kat always says like something that I always like, that she's like, what do we need in town that we go out of town for? And like you just saying that, like, is something that you would usually have to go out of town for. But now you don't have to.
Yeah.
You can. And going with that, you are taking new clients.
Sure, yeah.
Or
Patients.
I guess I take clients.
You take clients, he takes patients.
Also, I said it, I was like, that's not the right word. So you are taking new patients.
Yep.
So just call the office.
Yeah, call in 402-443-4989. You can also reach out through the website or email at info@Wahoo Creek Dental. Just give us your name and contact info, and we'll be in touch. Yes, we are taking new patients. I have a call as soon as you want to be coming in, just to get something on the books, even if you're not maybe at your 6 months since your previous cleaning yet. Just call and get on the books, so that we can make sure we get you in a timely manner. Because sometimes there can be a wait. Sometimes we have an opening within the week or within a day. So we'll keep you on a list and get you in and take good care of you. And the way our new patients visits work is, we spend a good amount of time right at the beginning just getting to know each other. I get to know you, you get to know me. And then we have wonderful assistants and hygienists that kind of start with taking all the appropriate photos we need and x-rays we need to properly diagnose everything. We have ways to just make sure you're getting the right type of cleaning. So there's kind of different levels of cleaning, and we want to make sure your gums and your bone are nice and healthy. We get you cleaned up, and then come back in. We kind of come up with a game plan. Sometimes there's nothing to do. Sometimes there's a couple things to do, and then no matter what there is, there's a wide variety of cases. We're gonna cater everything to you. So just meet you where you can, where you are, what you're able to accomplish, and then I'm just going to give you the options, and we're going to figure out what's going to makes the most sense in your case.
That's good.
Nice.
That's good. Just to know like how it's kind of would work, and yeah,
because I feel like if you haven't been into the dentist for a while, it might kind of seem overwhelming that like I know I haven't gone, I know I need to go, but like I'm gonna be afraid that they're gonna tell me I haven't flossed enough and I haven't brushed enough, and I don't want to see my teeth, but it's painless. It's super easy and super comfortable, and
and we have some people don't want to see their teeth. We have an intraoral camera, so we can take photos of all your teeth and every certain little spot that we want to show you and discuss. If you don't want to see it, you can feel free to. A lot of times we'll ask, we're like, "Do you want to see any pictures?"
They don't.
But some people are like, "No, I don't want to see my teeth."
Oh, really?
Interesting.
But some people love it. They're like, "Yeah, I've never seen a cavity before.
Right?
I can't picture what you're trying to describe to me. So let me see what that looks like." And it just makes, education is important to us, and we want you guys to feel completely comfortable on everything that we're doing and understand the process. And so that's what we're going to do, is we're going to teach you how it works and why we do it.
Well, and I also feel like if you haven't been to the dentist in a while or whatever, like you're not like judging when you go, like you're not gonna, like, if someone has some issues or whatever, you're there to find them and help them. Like you're not, so just don't worry about it. Like just go. And I know sometimes people it's kind of like the doctor and stuff, like they're like, oh, I just don't like going, but just you gotta go.
Yes, for sure.
And it's gonna get worse. So I guess just rip the Band-Aid and go.
Yeah.
And I feel like I feel like just like as humans, you feel like, oh no, I don't want you to see my teeth or whatever. Well, you're seeing teeth every day, so and dealing with all different things. So just do it.
Yeah.
Yeah.
Yeah, it's important. Your mouth's connected to the rest of your body, and certain things in your mouth can really affect the bacteria that are in your blood and your heart health and everything like that. And so it's important.
Yeah,
to get in
and
there
I don't know if
keep it
people
clean.
realize that.
Yeah.
Like how much having good teeth and mouth is.
Yeah.
Yeah.
What's your biggest tip for anybody? Besides obviously flossing and brushing, do you have like any hacks that you want to share, like for
that's a good
people's
one.
teeth?
Oh, that's a good one.
Yeah.
I should have had more time to brainstorm this one.
Sorry to put you on the spot.
Hacks for teeth. Good tip. Oh, well, I don't know. Here's a good one that I think a lot of people don't realize, and I didn't really realize until school, is that every time you eat, your environment in your mouth becomes more acidic. And it takes maybe 15 minutes or so to like get back to a neutral pH.
Okay.
And so what you don't want is an acidic environment for a long time in your mouth, and that's what causes cavities. So when you eat, you just kind of eat your meal and you be done, and you're not like snacking on and off for an hour, because that keeps that acid environment, and it drops more and more acidic every time you eat.
Yeah.
And so like give that time where you're not eating anything, or finish your meal off with something like cheese or milk, and that helps kind of bring alkaline in and make things more basic and prevent cavities. So yeah.
Okay.
Oh yeah, that's
I
a
had
good
no
one.
idea.
Yeah,
There you go.
that is a good hack.
So I should tell Eli just not to eat constantly.
Yeah. So you're gonna get cavities,
Right. Well, he has one on a baby tooth. We're watching.
Oh,
so.
Yeah. Other than, I feel like most people know the whole, brushing twice a day and get in there and floss once a day. And that was one thing that I think a lot of people enjoy learning is, there's definitely an acidic aspect to your teeth, and thinking about diet, what you're eating, and how often you're eating makes a big difference. Yeah.
Do you have a preference, I guess, of when you're flossing, like just the string or the sticks, or
no
you
preference.
are you just like just get in there and do
get
it?
in there and do it. I love it.
Yeah.
There's no wrong answer.
Yeah.
I don't care if you use an electric toothbrush or a manual toothbrush. Certain instances, if there's dexterity issues, an electric's going to do a way better job. But
Sure.
as long as you have brush and you're using brush and floss and you're doing it the right way, the right amount of times per day, it's great.
It's good. You're like gold star.
Yeah.
Now, I noticed you didn't say mouthwash. Do you think that's something that people should be using, or does that make a difference?
It makes things feel great.
Mhm.
But as far as, is that a make or break? Do I notice people that use mouthwash regularly versus don't use mouthwash? No. There's certain bacteria that are appropriate to have in our mouth.
Okay.
So we don't want to kill everything. So especially alcohol mouthwashes, we don't really recommend. That's just killing everything in your mouth, and there's good bacteria in there too.
Okay.
And so, I don't recommend mouthwash a whole lot. Just brush, floss. The TheraBreath, if you do want to use mouthwash and you like having that nice clean feeling, TheraBreath is one we give samples of in the office, and we recommend. A dentist made it a while ago, and it's just really, really clean, has the appropriate kind of stuff in there to just maintain the right oral environment.
Okay. And is that something people can find at their local pharmacy?
Yeah, most pharmacies, drugstores, Walmarts, they're going to have TheraBreath.
Where are you going to pick it up?
Yep.
Try
That's
it
good
out.
to know. I didn't know that there was a difference, and I didn't know that was maybe not a great thing. So
Right.
Yeah.
not every day we have a dentist in the chair.
I know.
So
like,
what are all those?
The dentist in the chair.
Yeah.
You're in the
I know
chair.
you're in our chair.
Yeah.
This one was okay being in.
Yeah.
Okay, good.
I'd probably just want to throw one plug out for anyone out there that is a hygienist in town or knows a hygienist in the area. We're eager to find the right person. We're I don't want to say picky, but kind of picky on having someone that fits our culture. We spend a lot of time picking the right people and developing our team so that we work really well together. And so we want someone that's going to be a great fit.
Sure.
Absolutely.
Yeah. Do they should they come to the office to?
You can come on in. You can call 402-443-4989. You can apply online, like through the website. You can just, there's a little chat thing in there. You can submit, contact us through the website.
Okay.
You can email doctor@wahooCreekDental.com.
Okay.
You can apply through Indeed. Lots of ways.
Okay,
So,
perfect.
yeah,
So yeah.
Find us and get in contact anyway.
Yeah. Grayson,
Nice.
do you want to come on here and?
Yeah, we have a little podcast fan here.
Yeah.
You want to come on and say
Wanna
hi?
come and say hi?
Yeah. No. I hear you listen to podcasts.
What's your favorite podcast again?
Curious Kids.
Oh, the Curious Kids podcast.
We
Nice.
need to check that out. Eli,
Yeah.
you said Eli might.
I bet he'd love
like that
that.
one.
Yeah.
Yeah.
We learned how rubber bands work this morning.
Oh, that's good. Yes.
Nice.
Well, now you have to watch your dad's podcast.
Yeah. Sound good? Yeah.
Yeah.
Do you want to do you want to wave at the camera and tell everyone thanks for listening?
Thanks for listening.
Anyway, bye.
No, Bye.
This has been a Chamber Chat with Kate and Kat. See you next time.